There it is.
Do you see it already?
Too. It says meeting is now streaming live on Facebook.
Okay, it's still coming up on my end. But I see us, okay. So we're gonna let folks see that this is live, because I know some people have expressed an interest as we begin the inaugural edition of the soon-to-be Emmy-winning Neil Campbell report. And so we're just going to kind of wait, because these things take a minute for people to populate. I see them populating now.
That's
That was Lucy Hall. I will call her back. So we are, Lucy Hall is a great recovery leader. Who's going to be joining us on our Wednesday town hall this week at 12 p.m. that Neil Campbell hosts. I can go ahead and tell you that we have Pierre Luigi on with us, and we have, and I was on the phone with her, State Representative Angelica Crumse, I think, close to it.
Figured out by Wednesday, right?
Yeah, great talk with her, and they will be our guest on Wednesday at 12 noon. But Neil, we have double digits now, so let's go ahead and get started. And what this is, it is the inaugural edition of the Neil Campbell Report. The concept behind this is we will do this at roughly 3 p.m. Monday through Thursday, probably at least through the month of May. And the idea is it's a short, if you're old enough like me to remember the old Paul Harvey show, just a 5-minute, maybe 6-7 minute thing where Neil will talk about one issue on recovery in particular each day. And so I want to, first of all, let everybody know how incredibly busy Neil has been. She has worked harder than the rest of the staff combined, and for her to make this time shows her commitment to spreading the advocacy word. And I want to thank you, Neil, for building time into your schedule and welcoming you to your first edition of your show.
Thanks, Jeff. And if I don't show up, it's still the Neil Report, but it's hosted by someone else.
I think it'll be the Neil Report with a special guest or something, like Johnny Carson used to have special guests. I don't know.
Perfect.
But the topic we chose for today that we want Neil to comment on is an extraordinarily important topic, and that is that Neil and Sherry Jenkins Tucker of the Georgia Mental Health Consumer Network have been leading the way to advocate for Governor Kemp to expand his coronavirus task force to include a subcommittee on addictive diseases and mental health recovery. And Neil, I'd like to turn the floor over to you to comment on the who, what, where, why, when of why this is so important to recovery.
Yeah, thanks, Jeff. And, this is an incredible time for all of us. We are still physically distancing, hopefully not too socially distancing, because a lot of us need that connection. So during this time of the coronavirus, the governor in his wisdom created a coronavirus task force. And we have been asking for weeks now to make sure that addiction and mental illness is covered in that task force. And of course, we don't think that any task force should be convened without the voice of lived recovery experience. There's a lot of things that are going on in our communities that we know about, that the leaders, the recovery leaders who are out there know about, and that we need to make sure that the task force knows about. So we know that secondary illnesses and other physical illnesses and emotional stress and trauma that's going on in the lives of people in recovery are hard to manage on a good day. But when you've been socially isolated, when you've been laid off of work, when you get a stimulus check, let's just be honest, when you get a stimulus check, that can have an effect on your recovery. We want people, our leadership, to know that these things do affect our recovery, that people with a substance use disorder diagnosis die 22 years earlier than a person without a diagnosis. People with a mental health diagnosis die 25 years earlier than someone without a diagnosis. So if we care about the lives of Georgians, we want to make sure with this pandemic that's upon us that we're also taking all this stuff into consideration, and that we are having conversations about what can help. Because Jeff, like I know, that when we take care of the least of us, right, the people with the least amount of resources, and those of us with a behavioral health diagnosis and condition are often the least of us. But if we can raise, rising tide lifts all boats, if we can raise the the circumstances of those of us living with a substance use disorder or a mental illness, we know that everybody else is just going to benefit. Because these are times when, you may not ever have had emotional trouble, or you may not have had a drinking problem or another substance use problem, but because of this virus and the things that it's doing to our society, our economy, it could really be having an impact on you. So we need the voice of lived experience on this task force.
Well, that's so important, Neil. It's not just to have a task force, it's to have the peer voice, the lived experience voice leading the way on the task force. And I think, what I'd like you to comment about is, so we have this virus, but it's more than a virus. It's a pandemic. It's historic. And we know maybe one of the closest things that we can compare it to is after Katrina, which was also a historic hurricane. Not all hurricanes are bad, but this one was notably bad. That in New Orleans and the parishes around New Orleans proper, that it was for at least a year afterwards that mental health cases and substance use disorder cases, that's when they really spiked. And this is a human issue, certainly.
Right.
But I think what you're trying to communicate to Governor Kemp, is it not true that this is going to be a major impact on the state budget, but also county and city budgets, and we want our state leaders to prepare now for what we know is coming?
That's right, Jeff. Thank you for that. And I actually volunteered at Katrina when Georgia had a response. We accepted a lot of folks from New Orleans, and I'll tell you, that was months and months of helping folks understand, get their feet underneath them, understand what's going on. It's going to be the same thing here. People are going to need, we always say that recovery is about three things, right? It's about something meaningful to do during the day, a safe and sober place to live, and a date on Friday night. And it's not just about using or not using anymore. It's all of those things that make up our lives and the quality of our lives. And, we know that there are health disparities in the way different races are treated, not just in this state, but in this country. We're going to have to deal with the fallout from that, because it is glaring and it's in our faces. And if we don't do something about that, we're not doing it right. And again, I think recovery can come to the table. We have a very diverse recovery community in this state. It doesn't have to be just me on the task force. It can be other people with lived experience that are doing amazing things in their communities. And that's the other message, Jeff, is that we don't want to come in and just point out the problems. Yes, people are struggling, people are suffering, but people are also getting well, regardless of the fact that many times you can't get into a treatment program, you can't get into a recovery residence. Folks are calling our warm line, they're coming on our virtual all recovery meetings, and they're getting and staying well. So if you really want to know how to do it, you look to people who've done it, and that's us. And so I think that it can only do well to be represented on this task force, this important task force.
Well, exactly right. And I think I'd like to interject with the CARES warm line number for those that might need it and not know it, 844-326-5400. We know the shifts have seen a 50% increase on a daily shift. We know there's a need for connectivity and connection. Neil created and established, and it's being led by team members on the Georgia Council on Substance Abuse, the virtual all recovery meetings, now twice a day, 7 days a week at 10 a.m. and 7 p.m. And those have dozens of people on a given call. So connectivity we know is important. And Neil, I don't know if you'd agree with this, but I'd like to ask you, when Governor Kemp formed the overall committee, then he formed subcommittees, and he had Mayor Bottoms of Atlanta. I live in the city of Atlanta. So my mayor, he reached out and had her chair a subcommittee on homelessness.
Yeah.
And she has led the way, because I'm right here in Grant Park. I know firsthand that there's homelessness in the city of Atlanta proper. Yeah. And he let her work with other advocates in the homeless community, peer voices, and they've done good work on that subcommittee. Yeah. And I think our message to Governor Kemp is, you've done good work putting these subcommittees together off of their initial committee, but you can't overlook the mental health community, the substance use disorder recovery community, because these impact over 800,000, really over 1 million Georgians.
Yeah, and it's not just in a metro area or a suburban area. We think of the rural areas. I think of all the recovery community organizations that are out there that are taking care of their peers right now. Their voices need to be heard. We hear time and time again, you know, I feel for our team down in Albany, the folks who are running a recovery organization. I mean, they have just been blown away by this virus. And what's going to happen to them as we start to, you know, who are the people that are not getting served? You know, Jeff, you work with me long enough now to know that's who I always think of. Who's not at the table? Who are we missing? And I know there's people in rural communities that have no voice, that literally do not have minutes on their phone enough to tag on to an all recovery meeting, or that they're not getting any support. So who's their voice? Well, it's going to be the people in recovery down in Albany. They're going to take care of each other. And so that's why it's really important that our voice is on this task force.
Exactly right. And we did discipline ourselves that these were going to be short updates, and Neil and I can talk all day because we love to talk about recovery. So we're going to wrap this up, but since Neil mentioned our leadership in Albany at the Change Center RCO, I would like to go ahead and say that Neil is also authorized, and we had our first one today where we interview RCO leaders, and on Wednesday at 1 o'clock on this same platform, Catherine Newcomb from the Change Center is going to be on to give an update from Albany as to what we've seen. We also have Shonda Santana on tomorrow and Alexia Jones on Thursday. So that's at 1 o'clock on the same platform with our RCO updates. Neil Campbell, the Neil Campbell report, the inaugural edition, running a little long, but we'll get more disciplined.
It was a bit, Jeff, it's a bit disingenuous to say I can talk for 5 minutes about anything. I could talk about 5 minutes about a puddle. So just, you know, sorry about that, y'all, but.
That's right. We can go on, and I'm worse. So we love what we do, and it's a blessing to work for Neil Campbell and to be family. Thanks, everybody. I know we had at least 28 on the first show here on the screen. Thank you all so much. If you've enjoyed this, please spread the word on our social media pages. Please follow us on social media. And as I want to thank Neil Campbell, and as I always say, recovery is real.
Thanks, Jeff. Bye.
Thank you, Neil.